Another rare type of shock that is mostly ignored and not discussed about is a traumatic shock. For the traumatic shock, it's simply a shock due to any physical accident. Alright. So a shock due to physical accident, we'll talk about the types of traumatic shocks. We'll talk about the symptoms. Then we'll talk about the treatment and complications. So for the definition, we said that traumatic shock is a medical condition that occurs when the body's circulatory system is unable to maintain adequate blood flow and supply of oxygen to vital organs. That's oxygenation. And this is usually after a traumatic injury. Okay, so it is actually a life-threatening condition that requires immediate medical attention. Right. So for the types of traumatic shock, if there's severe blood loss from trauma, that's hypovolemic shock. If there's a heart failure, that's cardiogenic shock. If there's a problem to the nerves, that's what neurogenic shock. If there's problem due to infection, that's what septic shock. Okay, so all of these are types of what traumatic shock. So for the symptoms of a traumatic shock, you'll be having a pale or cool skin. You'll be having some fast and weak pulse. You'll be having some shallow breathing. There'll be confusion or loss of consciousness. There'll be decreased urine output. Then for the treatment, fluid resuscitation, that's you'll be administering what fluids and body products. Oxygen therapy, you are providing what supplemental oxygen. Then pain management, you are controlling pain with medication. Then wound management, you are treating injuries and controlling bleeding. Then surgical intervention, you are trying to repair the damaged tissues and organs. For complications, traumatic shock can lead to organ failure, respiratory distress syndrome, cardiac arrest, and death of the individual. So that's it for traumatic shock, and see you guys.